Thank you for watching this video. Please subscribe to my YouTube channel and follow my Facebook page. Please also support my work on Patreon and Kickstarter. It will be greatly appreciated. Okay, so just to give me a refresher on what we're doing today. So we're doing the abdominal wall and abdominal lymph node stations. In the abdominal wall and lymph node stations, we're going to do the bones of the abdominal wall, the lumbar vertebra, and all the aspects of the vertebra. I'll try to remember them, otherwise I'll come back. Intervertebral discs, some thoracic vertebra, the abdominal ribs, the sacrum, a bit of the ilium, but I will not do the pubis and the ischium. So that I haven't covered. Another reason I haven't done is because the CT actually doesn't go that far. It goes almost to the ischial tuberosity, but not that far. So I'll do the ilium, then we'll do the muscles, and then we'll go into the abdominal lymph node stations. So hopefully I'll get this done in about 40 minutes, and then we'll go into the quiz as usual, and then the pathology quiz. So if you're ready to go, I'll just start straight away. So here we are. Can everybody see the screen? That's all good. Okay, so where does the abdomen begin? The abdomen starts when the diaphragm shows up. So we'll keep going inferiorly, and here the diaphragm shows up and the abdomen begins. Then it's the next thing I sort of do is find which vertebra is this. So you can see there's a rib coming out, so it's still a thoracic vertebra. Let's check out the next vertebra, and there's a rib coming from there also, still a thoracic vertebra. Next vertebra, rib coming from there, still a thoracic vertebra. And then next vertebra, no rib. Oh, that was a rib. Sorry, that was a rib. Oh, and this vertebra, no rib. So this vertebra is T12. So that's T12. And if you look at the vertebra, this is the vertebral body. This is the pedicel, the lamina. Then there's the spinous process that if you scroll up and down at some level you will see. That's the spinous process. Transverse processes on the 12th vertebra is actually a bit small, but there are these transverse processes over here that you can see. And that is a thoracic vertebra, not a typical thoracic vertebra. T12 is not exactly typical. There you've got the vertebral foramen, in which the spinal canal exists within the vertebral foramen, and the spinal cord exists within there. Another thing is that's the 12th rib. The 12th rib will have a joint with the vertebra, and that is called the costovertebral joint, like we did with the thoracic vertebra. Some of you were here with me then. And there's another joint with the transverse process, which is called the costotransverse joint. Now you can't see it too well here, but if I move up and show you a more typical thoracic vertebra, you'll see that joint far better, you see. So here in the thoracic vertebra, you can see the transverse processes much better. And so the ribs have two joints with the vertebra. One is with the vertebral body, and that's the costovertebral joint, and then one is with the transverse process, and that is the costotransverse joint. And so in the 12th that you see down there, you don't really see too much. Let me go back down. So in the 12th rib, you don't see it. You don't see that joint too well. Now that we're at the ribs, we might as well do the ribs. So you follow the ribs all the way. If you're looking at the ribs, you follow all the ribs all the way. And if these are the last two ribs, so if that's 12 and that's 11, they will just vanish into soft tissue because they don't have a costochondral joint. So this is also will vanish just right there. That does look like a bit of a costochondral joint, but rib 10 will have a costochondral joint, and that is part of the costal cartilage, which will go further up and then join further up into the sternum. And a good so that's your typical, not your typical, but that's your thoracic vertebra. But then when you come to your lumbar vertebra, the bodies become larger as you go further down. The bodies become larger, but the rest of the concept is again the same. There's your pedicel, there's your lamina, there's your transverse processes, there's your spinous processes. In the lumbar vertebra, you see these superior and inferior articular facets much better. You see that's the joint with the vertebra below. So you see those facets much better. I'll show them to you again in the sagittal section. They're seen better over there. And one thing, when you're passing through vertebra and it becomes gray like this, that is actually the intervertebral disc. And as you pass through different vertebra, you will pass through the intervertebral disc. So it's not too clear, but the outside of the intervertebral disc called the annulus fibrosus, that's a fibrous tissue outside the disc, and inside is the nucleus pulposus, and that's a bit more jelly-like and a bit more flexible. And so you can look at intervertebral discs in this section, but they are again better seen in the sagittal section that I will show you in a little bit. I think that really does cover most of the vertebra. I can't think of much more. Let me take you into the sagittal section. Yeah, this is good. Let me just magnify it a bit. So this perfect mid-sagittal section. It's really nice to see. The things you have to see is you have to see the alignment of the vertebra. The lumbar vertebra, as you may know, have a normal lordosis, as the thoracic vertebra has a normal kyphosis. So in the lumbar vertebra, you'd like to see a normal lordosis. You'd like to see inside the vertebra and outside, more like the anterior and posterior line. They should be more or less aligned. These are well aligned. You don't want to see too much subluxation or movement outside. And if you look at these vertebrae, you may see a few indentations, and they actually kind of look like fractures, but they're not. Sometimes fractures do look like this. Sometimes there's very small hairline fractures that do look like this. And if that's the case, then you can sometimes confuse these with fractures. But always keep the clinical picture in mind. If there's no history of trauma, or if there's no back pain, bone pain, this is what normal lumbar vertebra look like. And all vertebrae, actually thoracic vertebra, also have these few sort of indentations. Then you will look at the intervertebral discs. You should see that they have more or less an even space between them, and you can see the intervertebral discs in all of these different ones. If you're really looking for protrusions, you can see protrusions here. Actually, you can see, people usually when you go down to the intervertebral disc, especially when you get to L5S1 level intervertebral discs, there are a bit of disc protrusions, but they're normal, or even if they're slightly abnormal, they're not symptomatic. It's not something to worry about. Most of us will have these little protrusions, and especially if we get into our 30s or into our 40s, they start to develop. So you can see a little bit of protrusions here and here, and if there's no symptoms or anything, then there's nothing to worry about there also. And you can see the spinous processes on this side. And if I scroll a bit to the side, then you're going to start seeing the joints. So if you look at the joints, that's the superior articular surface, and that's the inferior articular surface for this particular vertebra. Let me just change the contrast a bit. Oops, slightly darker. So another way, a good way to do it is have the bone. You can see that's the superior articular surface. So that's the superior articular surface, and that's the inferior articular surface. So every vertebra has 4 facet joints, 2 superior joints that articulate with the vertebra above it with their inferior articular process, and 2 inferior articular processes that articulate with the superior articular process of the vertebra below. So that was a bit wordy, but I hope you understand what I meant. And so these are facet joints that you must look at. All of the facet joints, superior and inferior, as you go through this. And remember, this is on one side. Now if you scroll on to the other side, you'll have another set of facet joints. So these are your facet joints on this side. And here you can actually go and scroll through these lumbar facet joints to make sure everything looks normal, and if there's no misalignment, etc. Okay. The ligaments that you need to be concerned with, there's a ligament that you cannot see, but it always exists on the anterior aspect of the vertebral column and goes all the way to the sacrum, and that's the anterior longitudinal ligament. And there's a ligament right behind it which goes all the way down and again attaches to the sacrum, and that's the posterior longitudinal ligament. So that's the line of the anterior and posterior longitudinal ligament. Then there's the spinal canal, in which the spinal cord exists. You cannot see too much of the spinal cord and the meninges and the thecal sac, etc. An MRI is better to view those, and CT it's not too visible. And then behind the spinal spinal canal in the posterior sort of place of the spinal canal, there's the ligamentum flavum that goes around in this area, and that also comes down and attaches to the coccyx. So the ligamentum flavum is there. And then the ligaments of the spinous processes, they are interspinous ligaments, the ligaments that are between the two spinous processes, in the midline, because the spinous processes are in the midline. And then there's a supraspinous ligament that goes all along the edge of the spinous processes all the way up to the vertebral column. So again, revising the ligaments: anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum over here, interspinous ligaments, and supraspinous ligament. And these are the long ligaments of the vertebral column. And as I keep going, I'm still on move. Okay, then we come to the sacrum. As the spinal canal comes down, then you come down, you come to the sacrum. So this is S1, 2, 3, 4, 5. You can see 5 sacral vertebrae that's fused together. Just like the spinal canal, the sacrum also has a spinal canal. Some even call it the sacral canal, and it opens at the end, which is called the sacral hiatus. Let's see if there you go. There's a sacral hiatus at the end of the spinal canal in the sacrum. This is clinically relevant because there are actually ways to provide anesthesia to the sacral nerves from the sacral hiatus, useful in childbirth, etc. So the sacral hiatus, you will hear of it, especially if you're in gynecology. So that's the sacrum. The sacrum sort of curves the other way around and moves sort of posteriorly, unlike the lumbar vertebra, and has a sort of a kyphotic curve as well. Now I think that is all from the sagittal perspective. Let me go back. Let me come back to this perspective, which is the coronal perspective. And in the coronal perspective, you can see the vertebra as well. You should sort of see the alignment. They should be straight. It's not 100% straight, but that's all right. The sacrum also is a sacrum that I really would like to show you at this point. Yes, so if you come back here, you'll sort of see the facet joints. Again, you can see the facet joints in this view over here. See these facet joints, and then you will see the final facet joint. Oh, I kind of missed it. Between the sacrum and the L5. So the sacrum, that's the sacral lumbar joint between the sacrum and the L5. And if you look at the sacrum, that is the sacroiliac joint. This is the ilium. That's the top of the iliac crest. That's the sacroiliac joint. And as you move posteriorly, you will also see the sacral foramina. I'm kind of missing them, but they'll come right here. That's 1, and that's 2, and then there's 3, and there's 4. You'll see 4 sacral foramina along the sacrum. And that's pretty much it for the sacrum, I believe. That's your iliac crests. The iliac bone on the top are the iliac crests. The iliac bones are actually better seen in the transverse section because that's how you're going to end up seeing them. Let's go all the way down to see the iliac crests. There you go. The iliac crests sort of pop up right there. So those are your iliac crests. As the iliac crests pop up, the sacrum will also pop up. So that's the L5 vertebra, and then you'll have the first sacral vertebra. And as you see S1, you can see the sacral iliac joints show up, and you can see the first sacral foramen, and that's the sacral canal. And that is, so the most posterior aspect of it, like when it protrudes out the most, if you keep going inferiorly, you see the point where it protrudes out the most. That is the posterior superior iliac spine, and where it sort of protrudes anteriorly the most, that is the anterior superior iliac spine. And we will come to the anterior superior iliac spine again when we do the muscles of the abdominal wall. And so let's look at the iliac crest here. Let's move back up to the iliac crests. So if you look at the iliac crest, there's a part of the iliac crest that's going to be sort of protruding outward this way. That's the iliac tubercle. And then you can keep going all the way up to the anterior superior iliac spine. This over here is your iliac fossa, and then the ilium sort of goes down and the acetabulum begins. And from here the pubic bone continues on, and then that's the pubic symphysis. Up here at this pointy part, that's the pubic tubercle where the inguinal ligament attaches, and we will discuss that also. That's the ischial tuberosity, but I'm not going to go into too much detail there. That's the head of the humerus, and that's the acetabulum. When we do the lower limb, I will be going through these muscles and these structures in more detail. All right, so let me see if I've missed anything here. I'll go back to my list. And so we've done most of this stuff. Oh, the vertebral notches. Yes, let me just do that. Okay, fine. And yeah, more or less. I love the sacrum. Yeah, I'd like to show that to you. Sacral canal, number of sacral joints, sacral iliac joint, and the sacrococcygeal joint. So if you let's go again to the, and if you move laterally, now do you see that? These are your intervertebral foramen. This is where the spinal nerves are coming out of. So if there is a complaint of sensation loss or weakness in the lower limb, then these lumbar intervertebral foramens have to be viewed, and you have to look at them to make sure that they look like they're normal in position and size. There's not too much movement. Nothing has become too much smaller, or nothing has become too much bigger. And if you look at the intervertebral foramen, there's a notch on top and a notch below. Actually, the notch below is the actual notch on top of this vertebra. So that notch over there is the superior intervertebral notch, and that notch up there is the inferior intervertebral notch. So that was just one thing I think I missed. Apart from that, let's go into the iliac bone. Yes. Absolutely. So the vertebral notches, they're created by the two pedicles, and the one on top is actually the inferior vertebral notch, and the one below is the superior vertebral notch, because they're from the one next to each other. And if you look at the iliac bone, probably the best way to see one of the best ways to see the anterior superior iliac spine is over here. You can see it in the sagittal section, and then you follow the iliac crest on this side, and you'll see the posterior superior iliac spine, which is up here, which is down here. That's the posterior superior iliac spine, and this is the sciatic notch. The sciatic nerve comes out of there and forms the greater sciatic foramen, and this is the lesser sciatic foramen. Sciatic nerve comes out of there, and then the pudendal nerve sort of goes back in there. So these are I think the main bony parts that you need to see. And that was a quick overview. Any questions? All right. So while we're in it, let's do the muscles. Okay. So the muscles of the abdominal wall. There are two muscles. There are two groups of muscles of the abdominal wall. One group of muscles is the anterior abdominal wall, which also sort of includes the lateral abdominal wall, and then there's the posterior abdominal wall. So where should we begin? Let's start with the rib cage. Now there's as you may remember, there's the external intercostal muscles, internal intercostal muscles, and innermost intercostal muscles that then continue on to become the external abdominal, external oblique, internal oblique, and transversus abdominis muscle. And you should be able to see those three muscles here, especially as we go further down into the abdomen than those muscles. Now we're further going up. As we go further down into the abdomen, these muscles will become more apparent. And there will be a point where you should be able to see them quite clearly. So that's the external oblique, that's the internal oblique, and that's the transversus abdominis. You can sort of see it here also, external oblique, internal oblique, and transversus abdominis. They're attached to the rib cage on one end, and they come out like that. Now you can also see the sheets. That's the external oblique fascia, that's the internal oblique fascia, that's the transversus abdominis fascia. And these sheets go around this muscle, which is your six-pack muscle, which is the rectus abdominis. So there's your rectus abdominis, and then all these sheets come together and come into this central point, which is the linea alba. So linea alba, I'll just show you. Just look at the rectus abdominis and linea alba as we scroll up and down the abdomen, and it is fairly obvious until these are the costal cartilages, they show up, it's still there, and then the sternum shows up. So higher up you can see them like that. Now let's go and scroll down with the same structures, and what you will see is you will see the same thing. You'll see the rectus abdominis, the linea alba right in the center, and you will see it continuously, can keep scrolling it downwards, and it will all go all the way down to the pubic symphysis. And there you will see it go into the pubic symphysis. Now we're in the pelvis, and here the muscle belly gets smaller and smaller, and then the pubic symphysis will show up right here. All right, so that's the rectus abdominis. Now if you look, we talked about one line, we talked about the linea alba. The linea alba is right in the middle. I'd like to show you that too. You saw that little bump in here? That's the umbilicus. That's the umbilicus. So if you look at the linea alba, it's right in the middle. But then there's another line called linea semilunaris. That is right here. This is the linea semilunaris. The linea semilunaris is where it's basically the lateral border of the rectus abdominis muscle. And that you can see here also. And you can see the three sheaths coming through of the three abdominal muscles around the rectus abdominis here. So I'll keep looking at the linea semilunaris. Let me go up, pulling it up, and that's the linea semilunaris. You can see it gets a bit obscure when you get higher up. As you go lower down, it will become more obvious. So there, now that the ribs are here, it's absolutely not visible. But as you go further down, you'll see it. Now I'd also like you to observe, let me see where the lines, choose one side. Okay, let's look at this side. Now let's keep looking at this side and see how the sheath actually is going, the external oblique sheath is coming up anteriorly. The internal oblique sheath is going, there's going to be one part of it that goes anteriorly, another part that goes posteriorly. And the transversus abdominis sheath is going to go posteriorly. Keep an eye on this, and there will come a time where they will all sort of fuse together. And that's an important point. It will come near the pelvis, so keep an eye there, and you will see it happen as we go nearer to the pelvis. You see now they're coming together. And about this area or slightly higher, they all sort of come together. That is the arcuate line. The arcuate line is when this whole sheath becomes posterior. Now, above the arcuate line, the rectus sheet, this is collectively called the rectus sheet. These three epineuroses of these three muscles, when they cross over the rectus abdominis, they're collectively called the rectus sheet. So the rectus abdominis is actually covered by the rectus sheath anteriorly and posteriorly from these epineuroses of these muscles. But as you go lower down, the whole rectus sheet moves posteriorly. And when the rectus sheet moves posteriorly, then that is the arcuate line. I actually don't understand what the importance of the arcuate line is. We've been teaching it in anatomy for so long, and you'll always see it. There's the arcuate line, it goes posteriorly. But I'm sure there's some gynecological surgical significance here in relation to fascial sheaths, etc. Otherwise, I'm not actually sure if there's any other clinical relevance of the arcuate line. However, the relevance of the linea alba, the relevance of the umbilicus, and the relevance of the linea semilunaris exists clinically, and I will show you that when we do the quizzes. All right, what else? Okay, another thing that I'd like you to see, look at these three muscles. They superiorly, they're attached to the ribs. And as you go inferiorly, they attach to the iliac crest. So you won't see it too well here, actually. That's seen well here. So let me pull this up and let me magnify. And look over here. That's the iliac crest, and you'll see the three layers of the muscles here at some point. Yep, there you go. So you see the external oblique, the internal oblique, the transversus abdominis, and you can see these three areas. They are attached to the iliac crest. Higher up, they're attached to the lower ribs. And posteriorly, they sort of come together also. And you can't see it here, but I'll show it to you in another diagram. They go around this muscle here, which is the Quadratus Lumborum, which we will also do as we do the abdominal wall. Anteriorly, as I pull them, you will see them come together, and there was your rectus abdominis. That was the rectus abdominis. That's the linea alba, and that's how they come in and form the sheath around the rectus abdominis and attach right in the center. Another cool thing to see here is the inguinal ligament. So all the abdominal muscles come together, and as they cross the iliac crest, they attach onto the inguinal ligament, and you can see the inguinal ligament going down there. That is the inguinal ligament. And the inguinal ligament is also good to see on a transverse section because there are lymph nodes around that area. And if I open up this view, and if we go find the inguinal ligament again here, just slightly over there, then you're going to see the inguinal ligament here. So it is attached to the ASIS. So this thing you'll see, it'll come back attached to the ASIS. So keep an eye on that. Let me just open that up for you, make it larger. So it's right there. It attaches to the anterior superior iliac spine. And then you can see it go down, that's the inguinal ligament, and then sort of vanishes, but oops, it attaches to the pubic tubercle here. So that's the inguinal ligament. You can follow it back up. There it goes. And comes and attaches here to the anterior superior iliac spine. And I feel that is all for the anterior and lateral muscles. But then you've got the posterior abdominal wall here. And the posterior abdominal wall has, let me take you to a point where the belly is really nice. So that's the IVC, that's the aorta. There's this big belly of a muscle here. There's a big belly of a muscle here. There you go, it's more visible now. There's a belly of a muscle here, and a belly of a muscle here. And there's a belly of a muscle here, and a belly of a muscle here. So these are two different muscles. This is the psoas major, and this is the quadratus lumborum. So let's do the quadratus lumborum first. Quadratus lumborum, if you move superiorly, attaches to the lumbar vertebra and to the transverse processes. and then comes down and will attach to the iliac crest. So when the iliac crest shows up, it will immediately vanish. That's because it's attached to it. So let's look at the other side. It's attached to the iliac crest and comes up, and at about L2 or L3 it sort of vanishes, because that's where it starts from. So that's the Quadratus Lumborum, this muscle here. And this one is the psoas. So let's look at the psoas also. Let's go superiorly first. Oops, I'm going in. Let's go superiorly. Here is, so the psoas is attached to sort of the lateral sides of the lumbar vertebra, and as we go down, this is the psoas. It will get bigger and bigger. It'll get fatter and fatter. There it is. And let's keep following it down. It keeps going. Now it's in the pelvis, so that's a nice big 2 psoas muscles. And here it meets its friend called the iliacus muscle, which is this one right here. So that's the iliacus muscle. And as we keep going down, the iliopsoas will, the iliacus and the psoas will come together, form one muscle, and then they will go into the lower limb and attach onto. It goes a bit further, but I don't have more further down from this. There's no imaging, but this will go and attach to the femur, and it is your main flexor of the hip. So let's pull it back. That's the psoas, that's the iliacus. The iliacus stays in the iliac fossa. The psoas keeps moving up, and you can see it attaching to the sort of medial aspect of the lumbar vertebrae until it just vanishes. There you go. So Quadratus Lumborum, which is this one, and the psoas major. Now what are these big ones over here? These are actually back muscles, so they're not actually classified in as abdominal wall muscles, because your abdomen is here, but they are back muscles of the back. So this one is the erectus spinae muscle. They're quite thick down here. So this muscle is the erectus spinae muscle, and this one over here is the multifidus muscle. But I don't have them in my list because I think they're a bit more abdominal wall muscles than anything else. There is one more muscle in the list, and that is, it'll so slowly should start popping up here. There the belly is beginning, and then keep following that, keep following that, keep following that up. It goes high up into the arm. That's the scapula. Oh, it's still here. Oh, no, that's that one. And then it attaches to the arm there. So that is actually the Latissimus Dorsey. So that's the Latissimus Dorsey. And that is, again, a back muscle. And the Latissimus Dorsey, I might as well tell you because I put it in the list, attaches to this thing called the Thoracolumbar Fascia. And the thoracolumbar fascia is actually a fascia that comes around and has 3 layers. So one layer is behind these muscles, so it goes around behind these muscles. One layer comes anteriorly. It's actually the middle one, and it goes around this muscle, which is the erectus spinae muscle. And then there's a third layer that is the anteriormost layer, and that layer goes around the Quadratus Lumborum. So you've got those 3 layers, one around the Quadratus Lumborum, one around the erectus spinae, and then one that moves posteriorly. Let me actually just show you a Google image actually. All right. So that's where it is, but where's the cross section? There's a cross section. That's a very small image. Yeah, so that's a good one. So here it says long muscles of the back. It doesn't actually tell you which muscles there are. But here's the fascia, Latissimus Dorsey, and that's the posterior layer of the fascia. That is the middle layer of the fascia, and then there's an anterior layer there's an anterior layer that covers this area. Let me see, there's a bit better diagrams. Oh, there you go, simple as that. This is pretty much clear, I think. Thoracolumbar fascia. So rectus spinae and multifidus, that's the posterior layer, and there's the middle layer. And the anterior layer covers the quadratus lumborum. There's your psoas. The reason this is relevant is because the abdominal muscles also attach onto the thoracolumbar fascia. So this is one fascia that the abdominal muscle attached to, Latissimus Dorsey attaches to, and it embraces the quadratus lumborum and the rectus spinae muscle. And so it's relatively relevant. Massage therapists, acupuncturists, those people really know this fascia well because I think it causes lower back pain commonly. All right, any questions? So if you look here, the thoracolumbar fascia will cover this area, the middle. That's the posterior part of the fascia, the middle part of the fascia, and the anterior part of the fascia. And the three abdominal muscles will also attach onto that. Okay. Oh yes. So, and now another important way to look at the thoracolumbar fascia, it's just a bone, is it's this way. So let me just make the contrast nicer. And magnify this. So if you look here, now I'm going to move posteriorly. Those are your abdominal muscles, and do you see this muscle here? That is your psoas major. That's the iliacus. So if I keep moving anteriorly, you're going to see them come together and then move down and attach onto the femur. So that's your iliacus, that's the psoas that goes further up there. And if I move posteriorly from the psoas, you're going to see the quadratus lumborum on the two sides. That's the quadratus lumborum. And if you move posteriorly from the quadratus lumborum, then you will see the rectus spinae muscles. And this is the multifidus muscle. So the rectus spinae and multifidus I haven't really put in the list, but they're just here. All right. Jeez, it's been going on and we didn't even get to them, but I think that's it. Oh, the transversalis fascia I haven't done. We've done this. Then it's the lymph node stations. Transversalis fascia. So transversalis fascia. So if you look at the abdomen, you will see the abdominal wall layers. So the skin, subcutaneous tissue, external oblique, and its external and internal fascia. Then internal oblique with its external and internal fascia. Transversus abdominis with its external and internal fascia. And then there's another layer which is not visible on CT, but it exists. And that is the transversalis fascia. Once you cross the transversalis fascia, let's say you're a surgeon, you cross the transversalis fascia, then you're not still in the peritoneal cavity, because then there's the next layer, which is the parietal peritoneum. So then there's the parietal peritoneum, which you can't see again here, but this is inside the parietal peritoneum. And then once you cut the parietal peritoneum, then you are in the peritoneal cavity. And the visceral peritoneum covers the viscera. So those are the layers of the abdominal wall. And so that should be known. So if you come, it depends where you're coming from. So if you're coming from right here in the midline, let's say through the umbilicus, which you do, if you do put a surgical port through here, then it's skin, subcutaneous tissue sometimes, but just fiber tissue, linea alba, transversalis fascia, even behind the linea alba, transversalis fascia, and from the transversalis fascia, then you have the parietal peritoneum, and then you cut the parietal peritoneum. You don't cut the visceral peritoneum because, unless you want to do surgery in that area. But once you cut through the parietal peritoneum, you are in the peritoneal cavity. If you come laterally, Then it is your skin, subcutaneous tissue, external oblique, internal oblique, transversus abdominis, along with their fascias, which is, they all have external and internal fascias. Along with their fascias, then you've got transversalis fascia, and then there's the parietal peritoneum, and then you cut through that, and you're inside the peritoneal cavity. So those layers there too. All right. Any questions? Do I still have your attention? I hope so. Daniel had to go. That's unfortunate, but it's okay. All right, so what is next? Next are the lymph node stations. So lymph nodes are everywhere in the abdomen, everywhere. I mean, there is just a lymph node everywhere. And so it becomes like, what are they? So what they've done is that they have, there's two ways to divide lymph nodes. One way, which is a good way. One is there are intraperitoneal lymph nodes and they're extraperitoneal lymph nodes. That's a good way to divide lymph nodes, just the way that it's a good way to divide the arteries. Now, if you look at the abdomen, let's just look at this area. This is a good area. This is a good area. You've got the liver, gallbladder, you've got a jejunum, ileum, descending colon, a bit of transverse colon. Then you've got the kidneys, the IVC, the aorta, etc. So there's a retroperitoneal area, which is behind the peritoneum, and then there's the intraperitoneal area. Now, the lymph drainage for both these structures are separate because these are actually separate regions. Just like the arterial supply and venous drainage to these regions are separate, and the nerve supply is also separate. So one way to look at it is that. So it's intraperitoneal and retroperitoneal. Once you've got that in mind, then you just follow the vasculature. And the lymphatics are around the vasculature, and around the vasculature they sort of come together, and they're named around the vessels. So let's just do the extraperitoneal ones first. So extraperitoneal ones, if you start right up at the diaphragm. So this is the aorta, the IVC is right here. So there are para-aortic lymph nodes, which you sort of even can see here. That's a bit too dark. Still struggle to get that one right. There you go. You can see them here, but there's so many. These are peritoneal, these are intraperitoneal. But a lymph node is, if you see a little round structure and it doesn't seem to go anywhere, then that could be a lymph node. Now, this little round structure did go somewhere. It went into the aorta, so that's probably an artery. It's probably a vessel. But there are going to be a lot of structures here. We'll go through them, and they may be, if it's a little round structure that comes into view but then vanishes, it's a lymph node. And as long as it's lesser than 1 centimeter, it is not something that you need to worry about. And always, clinically correlate. Do they have other lesions like in the liver or the spleen, etc. So they're para-aortic lymph nodes. These are all retroperitoneal, not pre-aortic. Remember, para-aortic. They're on the side of the aorta. Now, as we go inferiorly, there are potentially para-aortic lymph nodes everywhere here. As we go inferiorly, you see the IVC. Around the IVC, all the way up to the diaphragm, there are also lymph nodes. So this lymph node station between the aorta and the IVC are called the aortocaval lymph nodes. So that's the aortocaval lymph node station. Then around the IVC, they could be in front of the IVC, so that's called precaval. They can be behind the IVC, and that's called retrocaval lymph nodes. So that's for the abdomen. So let's go all the way down. Then what happens is that there's a bifurcation of the aorta. When the bifurcation of the aorta happens, then the lymph node groups around the aorta, and the vena cava also divides into two, it has two tributaries. So the lymph nodes around these two are now called common iliac nodes. So the lymph nodes around these groups are now common iliac. Now, when the common iliac arteries divide into external and internal iliac arteries, then the lymph nodes around the external iliac, let's just follow it all the way until it becomes the femoral artery, which is here. They're called the external iliac nodes. So and that's the external iliac vein. So the nodes around this area are external iliac nodes, and the nodes around the internal iliac artery, which go all the way down to the rectum, they're called internal iliac nodes. So the nodes around here, they're called internal iliac nodes. And same thing on the other side. And so that's external iliac, that's the internal iliac. So the internal iliac nodes will be following the artery and the vein there. The external iliac nodes will be following there. And the external iliac nodes will go past the inguinal ligament, and then the nodes here will become inguinal nodes. So nerves around the femoral artery in this area, pelvic area, are inguinal nodes. And those, again, those are essentially the nodes that are extraperitoneal in this area. So inguinal nodes, external iliac and internal iliac nodes coming together to form the common iliac nodes here. The common iliac nodes come together, and then there are the para-aortic nodes, aortocaval nodes, pre-caval and retrocaval nodes. And that is how the nodes are that are extraperitoneal, outside the peritoneum. There is another group of lymph nodes that's in the pelvis that is extraperitoneal, and those are sacral nodes. They're just around the sacrum here. And pelvic cancers can spread, like uterine cancers and vaginal cancers, cervical cancers, and even rectal cancers can also spread to the sacral nodes. Prostate cancer spreads to the sacral nodes also. So they're over here. Any questions so far? Okay. Now that we've done the extraperitoneal nodes, now they're the intraperitoneal nodes. Now the intraperitoneal nodes, again, are associated with the arteries, and they function very similar to the way the arteries are, and they collect lymph also in the way that the arteries distribute the arterial supply. So let me explain. So the first major branch is of the aorta that is peritoneal is going to be the celiac trunk. It's going to show up here. Just give me a second. That is the celiac trunk. So around the celiac trunk, there are celiac lymph nodes. Now these are also called pre-aortic. They are not para-aortic, they are pre-aortic. So there are lymph nodes around the celiac trunk. If you keep moving inferiorly, then it's the superior mesenteric artery. So the lymph nodes around the superior mesenteric artery, and they're called the superior mesenteric nodes. And then if you go further down where the inferior mesenteric artery shows up, just around there, there it is. There's the inferior mesenteric artery. And where the inferior mesenteric artery shows up, they're inferior mesenteric nodes. So celiac nodes, superior mesenteric nodes, and inferior mesenteric nodes. So let's go back to the celiac nodes. Now the mesentery is full of nodes. As I said, there are lymph nodes everywhere. But you see the area of the mesentery, and if that area of the mesentery is supplied by the celiac trunk, then those lymph nodes will drain into the celiac lymph nodes. If that part of the mesentery is supplied, or the gut also is supplied by the superior mesenteric artery, then the lymph nodes will drain into the superior mesenteric nodes. And same with the inferior mesenteric artery and inferior mesenteric nodes. So let me explain in this way. I think a good Google image will. Let me just show abdominal lymph nodes. So one example is, this is a fairly good example. That look, you've got lymph nodes. Now if you look at this image, I hope you guys can see it clearly. If you can't, do let me know. But if you look at this image, the small bowel has been taken out, but the concept is still there. This large bowel is there, and you've got these paracolic lymph nodes. Now these paracolic lymph nodes, these ones are on the right. Then these are the middle colic. These are left paracolic lymph nodes. Then there are sigmoidal lymph nodes, superior rectal lymph nodes. So where would these lymph nodes drain? Now, when they call them paracolic because they're right next to the large bowel. So the superior rectal lymph nodes and the left colic lymph nodes will drain into the inferior mesenteric nodes. And the middle colic lymph nodes and the right paracolic lymph nodes will drain into the superior mesenteric artery. Then there are also lymph nodes that drains the appendix. They're appendicular lymph nodes, cecal lymph nodes. Sometimes their names are different in different nomenclature. And then, even though that the ilium and the jejunum is actually removed from here, in their mesentery there are also lymph nodes. So there are ilial lymph nodes, iliocolic lymph nodes that are close to the colon, then ilial lymph nodes, then jejunal lymph nodes. And all those also will drain into the superior mesenteric lymph nodes. So the mesentery is full of lymph nodes, but the area that the mesentery is supplying to, those lymph nodes then drain according to the arterial supply of that area. Does that sort of make sense? And so how would you tell in the abdomen then? In the abdomen, how you would tell is that, let's go down here. Now you see that there's a lot of mesentery here. Now if you look at any structure here, if it follows and you see it connecting, now that's a blood vessel. But if you see some other structure here that sort of pops up, like that one, and then vanishes. Did you see that one? You see that one? Popped up and then it vanished. Now that could be a lymph node. And there are many lymph nodes like that in the abdomen. Again, I said if they're small, less than 1 centimeter, usually, and there's no clinical correlation, usually they don't worry about it. But let's say they're enlarged lymph nodes here, which I've got in our pathology slides. What are they? And so what is the mesentery here? So this is a bit of the jejunum and the ilium here. So they're jejunal or ilial lymph nodes. If you go higher up, then most of this is the jejunum. So if you see large lymph nodes here, they're jejunal lymph nodes. If you come further down, then this is the jejunum, then this becomes the ilium, then these become the ilial lymph nodes. So these are jejunal and ilial lymph nodes are in this area. And as the arteries are, there's the iliocolic arteries, around the lymph nodes around here are the iliocolic lymph nodes. Then this is the ascending colon and this is the descending colon. So lymph nodes around the ascending colon are paracolic lymph nodes for the right side. And lymph nodes around the descending colon are paracolic lymph nodes on the left side. So lymph nodes around this area, if you move up, they're going to be paracolic lymph nodes, and lymph nodes around this area are also paracolic lymph nodes, depending on the side. So these are right paracolic lymph nodes, and here there are left paracolic lymph nodes. And it keeps going down. So we've done the colic. Now when we go from this further down to the pelvis, the left colic becomes a sigmoid. So the lymph nodes around the sigmoidal area. Those lymph nodes around the sigmoidal area that are around this area are sigmoidal lymph nodes. If you go further down, they become rectal lymph nodes, particularly superior rectal lymph nodes, because the superior rectal artery is a branch of the inferior mesenteric artery, and that still supplies. So their superior rectal lymph nodes are still mesenteric lymph nodes. Now, if you go deep down into the rectum where the mesentery ends, and you come to the lower end of the lymph node of the rectum, then they're mesorectal lymph nodes. They are not mesenteric lymph nodes. Sometimes they can even be called inferior rectal lymph nodes because they drain into the internal iliac lymph nodes. So those mesorectal lymph nodes that are very inferior in the rectum all the way down to the anal canal, those are the mesorectal lymph nodes. They are not peritoneal. They are extraperitoneal, and they will drain into the internal iliac lymph nodes. Then when you get superior, then you've got the superior rectal lymph nodes here, and then of course the sigmoidal lymph nodes, and then the paracolic lymph nodes. Does that sort of make sense? Now, even though I said that, there is one thing that we are still missing, and I forgot. I should have started with the celiac trunk. Now, we didn't mention all the celiac trunk lymph nodes. So a good place to go for the celiac trunk lymph nodes is the porta hepatis. Now, the lymph nodes around the liver, around the porta hepatis, and they're called caval lymph nodes. Then the caval lymph nodes, the lymph nodes around the stomach. So there's a stomach here. They're called gastric lymph nodes. Now, this lymph nodes, again, as I said, lymph nodes everywhere, but They're just named according to the area they are. There can also be gastrocaval lymph nodes, which are near the gastric area and the porta hepatis. So those are gastrocaval lymph nodes. There are lymph nodes that are near the porta hepatis, right here, near the portal vein and the IVC, and they're called the portocaval lymph nodes. So those are portocaval lymph nodes around that area. Then we've done the gastric lymph nodes on this side, but what about the gastric lymph nodes on the splenic side, around the greater curvature? And so they can be called the gastrosplenic lymph nodes. Then the lymph nodes of the spleen themselves that go around the splenic vein, and those are splenic lymph nodes. And as around the splenic vein we go through, there's the pancreas. There are lymph nodes around the pancreas, and they're called the pancreatic or peripancreatic lymph nodes. And these are all the lymph nodes of the celiac trunk. So all these lymph nodes will drain into the celiac lymph nodes. And the lymph nodes of the jejunum and ilium and the ascending colon, which are the right paracolic lymph nodes, and the transverse colon, they will drain into the superior mesenteric lymph node group. And then the descending colon, which is the left pericolic lymph nodes, and the sigmoidal lymph nodes, and the superior rectal lymph nodes, they will drain into the inferior mesenteric lymph nodes. And that's how the lymph stations of the abdomen are divided. Any questions? All right, so have we done this? We did the periaortic, aortocaval, precaval, retrocaval, common iliac, external iliac, internal iliac, inferior rectal, mesorectal, sacral, yep. And the intraperitic celiac nodes, yep, I think I covered those. The pancreatic can also, some of the pancreatic nodes can also drain to the superior mesenteric. That's correct. And then the jejunal, iliacolic, pedicular, yep. And yeah, so I think it's done. Any questions? All right. Well then, are you still in a position to start with the quiz? Let's go then. Go on, full screen. Okay, so who do we have with us? We've got so we start with bony parts of these vertebra. So what is A? Yes, the body. Can you tell me which vertebra it is? Oh, that would be L4. L3 it is. And correct me if I'm wrong at any point. All right, what is B? Yes, so that is S1. It is also called the sacral, I get the word, or promontory, I think. Or promontory, I forget the word. But it's that little pointy part that moves forward of S1. But correct, that is S1. All right, C? No, it is not the transverse process. Transverse process comes laterally. This is going posteriorly. Spinous process. Haha, yes, that's the spinous process. And D. I think that's, I don't know what I was thinking there. Yeah, I think that's S3. I think I was just thinking sacrum, but yeah, that is S3. You can see one of the divisions here. So, yep, I'll call it S3 slash sacrum, more or less. There you go. Thank you. Now, these are the intervertebral discs, and these are part of the intervertebral discs. So can you tell me what part A is and what part B is? And also which intervertebral disc this is? Annulus fibrosus. Yes, B is nucleus pulposus. And can you tell me which lumbar intervertebral disc this is? It is L5S1. I think you were saying that and I cut you out. So yep, it's L5S1, correct. Okay, excellent. Now these are the canals. I think spinal canal is correct. Spinal canal is fine. It's just that the spinal canal has a special name in the sacrum. Yeah, correct. Sacral canal. And the sacral. No, the coccyx is here. Doesn't have a coccyx. Does have a very small canal, but no. But that's the opening. The sacrum opens here. What is it called? No, but close. Sacral hiatus. It is sacral hiatus. Yep, that's the sacral hiatus. Well done. Now these are the ligaments. So A is around. Correct. Correct. Yeah, I'm sure. Okay, you can skip it, but I'm sure you'll know it. But all right, D. Yes. No. No, it's inside the spinal canal, but it's in the posterior layer. Correct. D is interspinous, yes. Yes. So interspinous is between the spinous. Well, these are also between the spinous processes. E sits on top of all the spinous processes and goes all the way up. No. It's something spinous though. Supraspinous. Correct. All right, there you go. So you've got the ligaments done. Excellent. Okay, what's next? These are the joints. I should have written that there. These are the joints. No, they're not two spinous processes. They are. It's the inferior articular process and a superior articular process. It is a facet joint, actually. Uh, as a matter of fact, let's just call it a facet joint. I didn't realize what I've done. Um, it's the superior facet joint for this vertebra, but the inferior facet joint for this vertebra. So I so I thought I was going to call this the superior facet joint and this the inferior, but actually that doesn't work because they both are superior and inferior for the different vertebra. So that is a facet joint. Or what's the other word for zygopophyseal joint? Thank you, Julian. Again, these are the parts of the vertebra, which one or two I've actually just named. Yes. Or just 1 minute ago. Oh, and yeah, B and C I mentioned about 10. I don't think I mentioned about half an hour ago. But A and D I just mentioned in the previous slide. Oh, you are correct, but A is the superior articulating process. Yeah, I understand. So this, let me just try to fix that. This is there. And yeah, that's why I tried to make them yellow, but they still don't work. So this is, yeah, fair enough. This is coming from this vertebra. So this is the superior articulating fossa. Yes, and this is coming from this vertebra. So this is the inferior. Yeah. Articulating process. I'm sorry? Well, let's try. Oh yeah, you've got the PDF for this. And that is B and that is C, this thing. Now I'm forgetting what they are too. I forgot the name of them. Hold on, I've got the name here. Yeah, the superior and inferior vertebral notch. That's what it was. Oh, where'd you go? The superior, so this is superior vertebral notch. And this is the inferior. And I should have labeled this. If I circle this structure and ask you to name that, what would that be? This inside the structure. Should label it, but that is the intervertebral foramen. That is where the spinal nerves exit. All right, let's go to, well done. Next one, is this the next one? Actually, hold on. Yes, this is the next one. Okay. Level of T12, and there are numerous structures, so it's not just one type of structure. You can. A is a rib, and I would say shaft of a rib. But rib is fine. Yep. Yeah, that's Latissimus Dorsey. Correct. Right side. Yeah, it's a bit. I'm trying to say this joint for C. I'm trying to say this joint for F. So the joint, what's the name of the joint that the rib has with the body of the vertebral process? And what is the name of the joint that the rib has with the transverse process? That's right. So this is the costovertebral. This is the correct. That's correct. Cross transverse joints. Good job. All right. Now this is right in the anterior abdominal wall. Correct. And D. Nope. Muscle. The six-pack muscle. Rectus abdominis. No, that's right. And there you go. Well done. Next one. Yes. Correct. Yes. 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 Oops, I think I went a bit before you. Transversus abdominis. Okay, good job. Well done. Now it's turn. Same things again. Similar things again. A few new muscles. Correct. Yep. Transversus. Yep, that's correct. I believe it is Lat Dorsey, unless I'm wrong. I think that is Lat Dorsey. That's what I would be trying. Correct. Quadratus Lumborum. GSOS major. Look, I'm not pushing left and right with you guys because I also get confused with left and right. But if you are doing an actual radiology exam, make sure you get left and right correct and mention that also. Because in radiology, they say if you get left and right wrong, it is wrong. So even if you identify correctly but tell the wrong side, it is wrong. And you know, that can be catastrophic. So imagine there's a psoas problem here and you say it's the left psoas when it's the right psoas. So, yes. Yes, they're this fat belly. This is really thin belly here. There's a really thin belly of the Quadratus Lumborum. It's just beginning. This fat thing here is the erectus spinae, and this is yes, and this is multifidus. You will see the Quadratus Lumborum get bigger in the slides as we go lower. So fair to be confused here because it's very small, but and it is also confusing even lower down because this big muscle you think is a Quadratus Lumborum, but it is actually the erectus spinae. All right. Yep, vertebral canal, correct. Vertebral canal. You can also call it the spinal canal. They're all correct. Correct. Yep. Yep. G is the lamina. Yep. Yeah, that's the facet joint, and I think it's the. I'm sorry. I think so. Yeah, it's the facet. It's inferior facet joint on the right side. Correct. Yes, inferior articulating process. Well, you see the spinous process. It's this relatively inferior. Yeah. When you see the superior process, you don't see the spinous process. You don't even see the transverse processes. Just like this joint, you will if you go inferior, you will start seeing the body of this joint of this vertebra, but you won't see the transverse processes or spinous processes. All right. B is psoas, correct. A is all of those three. It's a line. Let's just say it's a line. If that's the linea alba, what is this one? No, arcuate line is lower down. Nope. This is the line just lateral to your rectus abdominis. It goes all the way up, from the pelvis all the way up to the rib cage. Yes, correct. Linea semilunaris. And D. Correct. I actually thought I didn't put these in the quiz, but I guess I did. C and E. I'll give you E. Oh, go ahead and try. Correct. C is Quadratus Lumborum. And E is multifidus. All right. Well done. Your turn. And if you're thinking of A, it's that sheath I was talking about that has three parts to it. The rest I'll let you answer yourself. Almost. It is the umbilicus. Maybe I should. Oh, good question. I'll show it to you. Do you want me to? Oh, look, that's the linea alba. Keep looking there. And that's the skin. So I think you. So keep looking there. And here comes the umbilicus. There's the umbilicus. And it's gone. That's the umbilicus, but the linea alba is always there. But you're not wrong. You know, if I was marking an exam and you wrote that as linea alba, actually I was sort of pointing it there, so that is linea alba. I should have just pointed it there, but there you go. Linea alba, umbilicus. As long as you know this notch is the umbilicus, and it gives you a sort of landmark in your CT scans. So as long as you know that, which you do now, that's fine. Yes, the other ones. C is the psoas. No, iliacus. You will, when you see the iliacus, you should see the iliac crests on both sides. Now you know this one. Hey, oh, you know it. We've been following it. It's the same one as this one. Quadratus Lumborum. So that's the psoas. That's the Quadratus Lumborum. Psoas, major, Quadratus Lumborum, erectus spinae, and multifidus. You'll have. Oh, A. Sorry. That is the transversalis. No. Thoracolumbar fascia. Thoracolumbar fascia, and that's the thoracolumbar fascia, which attaches Latissimus Dorsey to the posterior wall and attaches the abdominal muscles to the posterior wall. And the thoracolumbar fascia has this posterior part, this middle part, and this anterior part. And I'll show it to you again, because this is something that if you are doing MSK of this area, you should know, because it is one of those things that always ends up causing trouble for people. So, okay, well, what it really is this thing. You see that? That's the thoracolumbar fascia. So that's what it would look like if you just saw it after skin dissection. But what it is something like this, that there's your, it doesn't mention the, oh, it does, Quadratus Lumborum and deep back muscles, which is basically the rectus spinae and multifidus. And then you've got your 3 abdominal muscles there. Can you see this, or is this too small? It's all right. So it's, oh, sorry about that. But let me see if it opens in new tab and if it's bigger. Oh, so this, oh, it's the same thing. It is bigger. So the 3 abdominal muscles come together and they attach to the thoracolumbar fascia. The Latissimus Dorsey also comes and attaches to the thoracolumbar fascia. So what is the thoracolumbar fascia? It is the 3 layers of fascia attaching there and there and there. So it's the transverse process, spinous process of the lumbar vertebra. It's got an anterior layer, it's got a middle layer, and it's got a posterior layer. Between the anterior and middle layer is the Quadratus Lumborum. Quadratus Lumborum lives between those 2 layers. And between the middle and posterior layer is the, what was this again? The rectus spinae and the multifidus, which is here, which they've made collectively called deep back muscles. So again, if you look at it in individuals, it's a pretty strong, according to Ken Hub, that they've shown it like this. That's exactly what it is. And it's a very strong fascia. This shows it. Latissimus Dorsey attaches to it. So that's the thoracolumbar fascia. So abdominal muscles also attached to it, and the Latissimus Dorsey attached to it, and the Quadratus Lumborum lives within it. This is another good way of showing it. And the Longitudinal tab. No, not the link. Where is open image? So that shows it again. The 3 abdominal muscles coming together and attaching to the thoracolumbar fascia. And that is your outer layer, middle layer, that's your external layer, and that's your internal layer. That's your Quadratus Lumborum, that's your Latissimus Dorsey, and that's your psoas major. And that's how it comes in. That's what I'm sort of trying to show in that one. So that's your Quadratus Lumborum. That's your rectus spinae. That's the multifidus. You can't really see the Latissimus Dorsey here because it's nothing but fascia left here. But you can see the 3 abdominal muscles coming and attaching to the fascia. Alrighty. Let's move on. Whose turn was it? Yes, that's the iliacus muscle. Yeah, I'm thinking about too that. What was I thinking when I did B and D? I think they are the iliac crest. I don't know what I was thinking. I think there was a point that I wanted to point the iliac tubercle, but I don't think it was here. So I don't know what the difference between. I'm confused myself. They're both the same. And correct. That's psoas major. It becomes pretty thick here, and then it will attach with the iliacus. So now we're at L5. Now we're going down to S1. Correct. Yep. Yep. No, it is the rectus sheath, but the rectus sheath is now, it is the rectus sheath, but this is at the level of the arcuate line. Well, we're in the pelvis, and the rectus sheath sort of comes together as one layer, and it moves posteriorly sorry, not posteriorly, but collectively it moves anteriorly. I'm sorry, I was telling you it moves posteriorly, but collectively it moves anterior to the rectus abdominis muscle. Yes. Sacrum, but that's the yeah, ala of the sacrum. The ala, I think I may have forgotten telling you, but the wing of the sacrum, ala is the wing that articulates with the sacroiliac joint. It's called the ala of the sacrum, but that's fine. Sacrum is okay. It is a foramen, but which one do you think it is? No, not the sciatic. Which vertebra? It's a vertebra. It's a vertebral foramen. Spinal nerves come out of here. So which spinal nerve would be coming out of here? Yes. S1. No, S1 spinal nerve. So it is the geez, why how could I forget the name? It is basically, I just wanted one of the names that I, what was the name of that? It's very simple. I'm having a mind block here. Sacral foramen. It's just a sacral foramen. So yeah, sacral foramen. So these are the foramens of the sacrum. They've got S1, S2, S3, and S4 have one, because that's where the nerves come out. And what is G? Yeah, spinal canal or sacral canal. Correct. Well done. Now we're at S2. Correct. Correct. Yes. It is the SIS. Correct. No. Oh yeah. Correct. Well done. Look at that. All right. Fantastic. Okay. They're all the same that we've done the past in just this previous slide. Correct? No. I thought it was the rectus sheet, but then she corrected herself. Inguinal ligament. Just from positioning, the rectus sheath, you're not wrong. All those muscles become, when they get down to the pelvis, when they get below the ASIS, they just attach onto the inguinal ligament. So the inguinal ligament is the attachment of all those muscles. Let's see if it shows up properly enough. A diagram that shows it relatively well. This one kind of shows it well. So actually not too well, but that's what the inguinal ligament is, and all your abdominal muscles of the anterior abdominal wall, except the rectus abdominis, they all come and attach here. So if you're following the rectus sheath, then as it crosses the ASIS in this angle to the pubic tubercle, it will be the inguinal ligament. External oblique. If you look at the external oblique, which is this muscle, nice, thank you for Ken Hub. All this is external oblique, but here, as it crosses from the ASIS, this is the inguinal ligament. So if you follow so you're not wrong when you say the rectus sheath, only if you follow it downwards at this level, it will become the inguinal ligament. Alrighty. So we're done with this. Well done. You got them correct. I just haven't written them. Similar thing, same thing. The level of S4. Yeah, we've done this, but if you wanna answer again. Yeah. Yeah, A is the inguinal ligament. Iliac Crest. Iliopsoas now. I don't know how to spell it. Yes, it's become one muscle now. Iliopsoas, the iliacus and psoas are now come together. Yes, absolutely. There is really no other reason to think so. Let me just show you. Let's look at it too. Let me magnify this, and let's go down, 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 down. Iliac Crest, psoas, iliacus. Just look at both these muscles as we go further down, and you see how they fuse together. They become one muscle, and then they're attached collectively to the femur. That's the iliopsoas. Okay, there we go. Well done. And just answer that for you. I actually don't know too much exactly, but that is also the iliopsoas. All right. I had nothing to label. We've just gotten one step lower. It's coccyx. So the muscles here are now pelvic and lower limb. So when we do lower limb, we will do that. Okay. All right. Answer these. They're not. He is. Correct? Yeah. Yep. Yep. Correct. Transversus. I should let you remember. No, I should have let you remember because that would have helped you, but I did that. D is the innermost layer after the transversus abdominis. No, it's called a fascia, which covers this whole inside. No. That's outside. Yeah, back and outside. So this is inside the muscles, transversalis fascia. And after the transversalis fascia, you have the parietal peritoneum. All right. You can answer these ones. I think it's not too different. Nope. It's gone more posterior. No. Fair enough. Iliopsoas, I know what you're thinking. It would have been down here. But think you're still in this plane, but you've moved more posteriorly. Yeah, which one is Quadratus Lumborum? Which one is is yes. Quadratus Lumborum. This is. That is Iliac Dorsey. No, it is Iliac Dorsey. You can see it going up in there. Yes, yes, so it's again. All right, well done. Nice. So what is left here? That's it. Okay, people, it's 7:45. Now we can do the lymph node stations like here. What lymph node stations are here? or we could do the pathology quiz. And all right, now there's so many, but I just sometimes you know I finish early, and sometimes I sometimes it's just late. Okay, people, I think I will have to go through the pathology, because if I question you, we won't finish by 8, unless you want to stay till 9. Are you guys willing to stay till 9? I think. Okay. Okay. So it's a hernia, and it's a ventral hernia. It's coming through the linea alba. It could be an umbilical hernia. I think I wrote umbilical hernia for it, but actually I'm not sure if it's an umbilical hernia. I quickly wrote umbilical hernia, but now that I think about it, I don't know if it's at the level of the umbilicus. So it may not be an umbilical hernia, just maybe a ventral hernia right anteriorly. But you know where the hernia is. It's coming out of the linea alba. So there you go. Now, this is a same hernia from the anterior wall, but you see more here. You see dilated loops, or fluid-filled dilated loops in the ilium, and you also see ascites and fluid filling into the peritoneal cavity. So this is a hernia that has strangulated and caused a bowel obstruction. And that's hernias can cause bowel obstructions. So if you have a question, just come in and shoot. Okay, now this is a hernia going through this line, and we've done this line. This is the linea semilunaris. This is the rectus abdominis, linea semilunaris, and these are the abdominal muscles. So there's certain weaknesses in the abdominal wall. One is in the midline, linea alba. One is in the line on the side, which is linea semilunaris. And the hernia through that is called a special thing, the Spigelian hernia. A hernia through the linea semilunaris. Now, what was this? This is another hernia. Oh, that's the hernia, and it's called a bowel obstruction. So I think this was an incisional hernia. This was post-operative, and after healing, the anterior abdominal wall in that area becomes weak, and a hernia protrudes out of the incision. So this looks like an incisional hernia. And if you notice, it's actually not coming out of the patient's skin. You wouldn't be able to see this on examination externally, but it is a hernia coming out through the abdominal wall. And it's caused a bowel obstruction, so it's pretty serious. So incisional hernia with bowel obstruction. Now what is this? Now this is low down in the pelvis, and this is a male, and the hernia seems to be going into the scrotum, and that is an indirect inguinal hernia. Oh, and it has a cause with bowel obstruction. I think where I picked it up must have mentioned bowel obstruction, but here I can't tell if the bowel is obstructed because the bowel is higher up. If I did have a CT, the full CT, I could have told that, you know, when I went higher up into the abdomen, there'd be a bowel obstruction, and lower down you'd see the hernia. All right. What is this? Oh, there's another hernia similar to the hernia that comes out of the linea alba, but there is no bowel obstruction. So this is a Spigelian hernia, but without bowel obstruction. Okay, now this is another hernia. Now this is called a lumbar hernia. A lumbar hernia, remember, there's an area where the lateral muscles of the abdominal wall attach to the thoracolumbar fascia, which is over here. That is also a weak spot. So you can get hernias there also, and that's called a lumbar hernia. Now that's another hernia, and you can see yourself that you are actually down in the pelvis. That's the pubic symphysis. That actually is the pubic tubercle. So this is right next to the pubic tubercle. They've mentioned it also. So hernia next to a pubic tubercle is an inguinal hernia. You cannot tell if it's here at this level, you cannot tell whether it's direct or indirect. If it was in the scrotum, it's most likely to be indirect, but up here you cannot tell if it's direct or indirect. So it's just an inguinal hernia for now. And oh, it's a direct inguinal hernia. Maybe they saw surgically, but on CT you cannot diagnose between direct or indirect, but an inguinal hernia nonetheless. Now those lymph nodes. Okay, people, mesenteric lymph nodes. And this is sort of something that I want you to sort of, I mean, this is important because you should know your lymph nodes stations. I mean, abdominal lymph nodes is a real issue. So what lymph node group do you think this is? Now, where are you? You've got the kidneys here. That's the stomach. That's the liver. So think what, and they're mesenteric lymph nodes. So they're inside the mesentery. They're not extra mesenteric lymph nodes. So those are the gastrohepatic lymph nodes. Because there's the stomach and there is the liver. Let's keep going. Now this lymph node, if you look at it, it is right near the porta hepatis. Because that's the liver, that's the portal vein. So what lymph node is that? Oh, that's a gastrohepatic lymph node also. Oh, there's a stomach right there, of course. I thought it was portal lymph, caval lymph nodes, portal lymph nodes. Probably another one there. Okay, so this is again the porta hepatis. And that's the IVC. So lymph nodes around that area. So periportal lymph nodes. These names are slightly interchangeable. But you should know the areas nonetheless where the lymph nodes are. Now look at this one. That's the aorta, that's the IVC. Lymph nodes here. So the lymph nodes around the aorta. So I believe these are periaortic lymph nodes. That is an aortocaval lymph node between the aorta and the vena cava. That's a retrocaval lymph node. There could be precaval lymph nodes up here. So these are all extraperitoneal lymph nodes. And so what we have here, precaval, retrocaval, periaortic, and aortocaval lymph nodes. Okay, let's keep going. Again, what you have here, so that's the aorta. IVC will be, the IVC is a bit further up here. But it's again in the same area. So let's see, portocaval lymph nodes again. Porta hepatis and near the IVC and the porta hepatis. All right, now what's the organ here? Lymph nodes around this area. So what's that organ? If you can remember, splenic lymph nodes. Okay, now these are mesenteric lymph nodes. Again, that's the liver, that's the spleen. It's the aorta here. What is that? That's the stomach. And so these are gastrosplenic lymph nodes. I wonder why gastrosplenic should be here. These could also be called gastrohepatic. I think these are gastrohepatic lymph nodes. I think I got that wrong. These are gastrohepatic nodes. Oh, no. This is a gastrosplenic node. I forgot. Yeah, that's the gastrosplenic node. Now I remember. That one there, because it goes along with the splenic vein. The pancreas is here also. That could be considered a gastrosplenic node. But these would be the pancreas is right here. This is where the pancreas should be. That's the stomach. This is the stomach. That's the spleen. And so that can be, the lymph nodes here can be considered gastrosplenic, and the ones here definitely gastrosplenic. These are gastrohepatic. Now here we're a bit lower down the liver, and I think this is trying to show that structure here is the pancreas, and this would be a peripancreatic nodes. I think I've got another one that shows the pancreas much better. Now that's a pancreatic mass. The pancreas is a bit hard to see. It looks like this mush in the CT scan, but I showed you how to follow it with the splenic vein, and as you follow the splenic vein, that's how you find the pancreas. So if you did have a CT in which you can scroll down, you would see this is associated with the splenic vein, and that's the pancreas. So that's a good massive pancreatic mass right at the head. All right. Okay, now these are again mesenteric lymph nodes. They are in the mesentery, but if you look at this area, see how high or low you are. So you can see you can't really see the liver there, and you can't see the spleen here. You can't see the stomach. So this is lower down, and so these should be either jejunal or ileal lymph nodes. And what is that? Jejunal lymph nodes, and they will drain to the celiac lymph nodes. Okay. Now, where are these? Again, these are mesenteric lymph nodes. Oh, they're in the pelvis. So they're in the pelvis, so this would be the ilium. So these are ilial lymph nodes. Okay, now look at that. Now, a lot of lymph nodes here. This just looks like there are many lymph nodes, actually. So that's what happens when you get, you know, a rectal cancer or colon cancer. You have a lot of lymph nodes that's metastasized into the abdomen. They actually call, oh yeah. So you see it's a bit lower down. You can't see the liver or the spleen, but you don't see the iliac crest, so it's not actually in the pelvis. So this is still the ilium. You can also consider this the jejunal, but you can see lymph nodes. So this is your ascending colon. That's the descending colon, and that could be pericolic lymph nodes here, but right pericolic. And I believe there would be lymph nodes here also, left pericolic lymph nodes. So, so these are ilial nodes. Could be jejunal nodes slightly up on this side, and left and right pericolic lymph nodes. Okay, so what is this? You can see this mass here. What structure do you think this is? So this is the descending colon. So that's the liver, that's the kidney, that's the ascending colon, this is the descending colon. And I don't think I can see, oh yeah, you can see lymph nodes here. So yeah, those are pericolic lymph nodes, but those are left pericolic lymph nodes. Yep. That should be the spleen. Spleen or the stomach, depending on how far back we are. That would either be the spleen or the stomach. No. Well, look, you can get that wrong, but if you actually had the CT, you could scroll forward and back. So that is the issue. I mean, expecting people to identify just on one plane is a bit hard, unless it's obviously the liver, you know, or the kidneys, or the psoas muscle, or iliacus muscle. Well, you've learned a bit today. Okay, oh my God, well, look at this. Well, first thing you need to know is that it is in the pelvis, and the iliac crest has sort of gone down also, so it's in the lower pelvis. So that seems to be like the sigmoid colon. That looks like the rectum. So these would be rectal cancer with sigmoid nodes and superior rectal nodes. Okay, now this again looks lower down the pelvis. The iliac crest is awful past. And these are, so that is around the rectum. So these look like either superior rectal or mesorectal nodes. So these are mesorectal nodes. All right, let's keep going. Oh, look at these nodes. Now, this is again in the pelvis, but what artery is up here? And so these over here, oh, and then when you do a PET scan, they really light up. That means they're metastatic. These nodes are your external iliac nodes. That could be an inguinal node, actually. The external iliac nodes are here. But this is definitely external iliac nodes. All right, let's keep going. What level? Again in the pelvis. Posteriorly, that's like the sacrum. And so you got nodes in this area. So these are inferior rectal nodes or mesorectal nodes around the rectum. Oh, sorry, you're right. Internal iliac nodes. That's also fair because internal iliac artery is in this area exactly. So yep, internal iliac nodes is actually more correct for this. I forget my own teaching. Here, that's the sacrum. So right around the sacrum can be right in the midline or just lateral to the midline. If you have nodes right there, those are sacral nodes. And where are these? So they're in the lower limb. And these are inguinal nodes. And I think that's it. Thank you for watching this video. Please subscribe to my YouTube channel and follow my Facebook page. Please also support my work on Patreon and Kickstarter. It will be greatly appreciated.